to my channel. My name is Jazzy RN. I've been a remote utilization review nurse for over 9 years, and a goal of my channel is to help nurses pivot from the bedside to remote work. This company is Winning Assistance. They are hiring a neurosurgery patient coordinator, RN. This is a full-time job. The work hours are between 8 a.m. to 5 p.m. Pacific Daylight Time. Work days are Monday through Friday. The salary is 6 to 7 per hour depending on experience. The workplace is remote and the location is the Philippines. Now first I'd like to go straight to the requirements of the job. And the requirements are RN license required, experience reviewing patient medical histories and medication lists, basic familiarity with medications commonly used in surgical or dental settings, familiarity with medical and dental terminology, particularly related to oral surgery, high level of reliability and proactiveness, strong critical thinking and problem-solving ability, knowledge of oral surgery terminology and workflows, excellent communication skills for patient and provider coordination, strong understanding of HIPAA compliance and patient confidentiality, high attention to detail and organizational ability, ability to manage complex, multi-step patient processes, ability to work independently with minimal supervision, and strong focus and productivity in a remote work environment. They also will prefer candidates with the following experience as a medical receptionist, medical scribe, patient care coordinator, dental receptionist, and healthcare administrative assistant. Revia is hiring a part-time RN as a clinical quality assurance RN. The start date is March 4th, 2026. The shift time is 9 a.m. to 6 p.m. The pay rate is $700 per month, and this is a part-time position. It is part-time as in 20 hours per week. And I want to go straight to the qualifications of the job. So you must be an RN and licensed, experience working in home health quality assurance, clinical documentation review, or chart auditing, strong knowledge of OASIS documentation standards and CMS Medicare home health requirements, experience with Kineser, WellSky, home health or similar home health EMR systems, solid understanding of PDGM coding and diagnosis review for home health services, ability to identify documentation gaps, compliance risks, and coding inaccuracies, strong attention to detail, analytical skills, and organizational abilities, excellent written communication skills for providing feedback to clinicians and clinical staff, ability to work independently in a remote environment, and complete QA reviews and coding tasks within required timelines, and the ability to collaborate effectively with nursing leadership and clinical teams. This company is called MedVirtual. Now this is their LinkedIn page and a little bit about MedVirtual. They have 51 to 200 employees, 7,000 plus followers. They are a staffing and recruiting company based out of Los Angeles, California. Now I did try going to this website link here, but this is actually a link to schedule a Zoom call. So instead, what you can do is go to medvirtual.ai as well as go to the LinkedIn and then click on jobs to find the available openings. Now there are multiple openings that were in United States, Philippines, Latin America. So this position here in the Philippines is a week old, but I still want to show it to you. And whenever you go to the medvirtual.ai website here, if you just scroll down, you'll see positions available. And this one has a medical nurse, starts at $17 an hour. The only problem is it doesn't say exactly where the location they are hiring from through this link. It just gives you information regarding whether you're a medical nurse or a clinical nurse, starting at $17 an hour, and it doesn't say exactly what location they're hiring from. So what I'm going to do is go back to the LinkedIn page. So MedVirtual is hiring a medical nurse with a U.S. RN license in English. This was posted a week ago, and so far only 80 persons clicked apply. And I want to go straight to the requirements for the job. You must have a nurse license in the United States, must be a licensed RN or equivalent, or licensed medical doctor, dentist, or veterinarian, license acceptable from any other country, approved to be in our candidate pool or the United States, minimum of 1 year working remotely at a U.S.-based healthcare company in a clinical capacity, or minimum of 2 years of working in their medical capacity as a doctor, nurse, dentist, vet in their own country, strong understanding of medical terminology and clinical workflows, HIPAA compliance knowledge is required, other front or back office knowledge preferred but not required, willingness to work in U.S. time zones, that's Pacific, Eastern, and Central, and a high school diploma or equivalent is needed. And this is the requirements that is needed for the equipment you'll need to work the job, regarding your internet, how much megabits per second you must have, with a reliable backup connection, as well as your Intel Core i5 7th generation or higher for your processor in your computer. They want you to have 8 gigabytes of RAM, 256 gigabytes of your SSD or HDD with 50% free space, a webcam at 720p resolution or higher, operating system of Windows 10 or later, noise canceling headset or earphones, and a quiet, organized, and distraction-free workplace. Also, I do want to mention, if you were to go to the description box below, you'll see a link to over 80 companies that hires nurses to work remotely. And most of these companies do hire nurses to work remotely in the United States, but there are several companies on this link that hires nurses who live in the Philippines to work remotely for American companies. Also, if you scroll towards the very bottom, you will see a couple of links regarding how to do your due diligence whenever you are researching companies you're looking to work for. So this is including Glassdoor, Reddit, the Reddit threads, as well as Comparably, Teamblind, and Fishbowl. I also have a course to remote nursing, the cure to bedside burnout. And this link here will bring you to a list of items you can purchase from Amazon if you need additional items for your remote job. And at the very bottom, there are over 20 questions here regarding frequently asked questions and answers regarding working remotely from home. This company is called UST, and I found the job for an RN on their LinkedIn page. For some reason, it's not appearing on their careers page. So I went to their careers page and looked for nurse. So basically, once you go to ust.com/en/careers, you have a list of over 1,000 jobs. I just typed in nurse, and I have 5 results, but neither of these results are what I'm looking for, what I found on LinkedIn. This is the only position right here, the QARN position, Utilization Management QARN, and this was the only one on this site that is remote. But the job I found on LinkedIn, it is a remote position, and it is for nurses in the Philippines. It was posted 2 days ago and had 20 applicants. So far I can't figure out why it's not appearing on the company website, but it is not appearing on UST's company website. So back to LinkedIn. I'm going to go straight to the qualifications of the job. You must be an RN with current, unrestricted U.S. registered nurse license. You must have 3 years of direct clinical nursing experience. That's at the bedside. They want you to have 2 years experience in U.S. healthcare, in utilization management or case management. They want you to have MCG certification is a plus, and Health Edge HRCM or guiding care experience is a plus. Now, I do have experience working with MCG as a utilization review nurse. The only way how I know how to get experience prior to the job is with the mcg.com/courses/website, where you actually can enroll in a course. If you do decide to do this, I would suggest the MCG Care Guidelines Specialist Certification, which is ISC/GRC, and that just stands for Inpatient and Surgical Care and general recovery care guidelines. It is kind of pricey, but it's also an option for you if you want to stand out from a pool of other nurses. Unless if you already have MCG or interqual experience. I did do some research on Health Edge. I've never heard of it before, and it is Health Edge HRCM. And here's their website, healthedge.com. I have no idea what it is, but if you want to do some research on Health Edge, here's the site you can go to. This is the LinkedIn page of Shearwater CPO Home of Clinicians, and a little bit about them. We are home to 4,000 plus clinicians. That includes nurses, medical coders, clinical researchers, physical therapists, and healthcare graduates who have trusted us with their careers. Now, if you go to their website and click on it, the website has expired. So the only way to find their jobs is through LinkedIn and just click on jobs for their job listings. So the position I want to show you is a US RN position. And this job was reposted 2 days ago and over 100 people have clicked apply. But I just want to put this on your radar for any jobs you may be interested in currently or in the future. I want to go straight to the requirements. Now they do require a US RN with a New Jersey license. So for the qualifications, they want you to have an active New Jersey license, 2+ years acute care or utilization management experience, strong communication skills, voice role, shifting schedule. That means your schedule can change, which means the start hours could change from day to day or maybe week to week. They don't specify that. And it's also temporary work from home. They don't mention exactly how long the work from home option will last. Now, I am a utilization management nurse by trade for over 9 years. So your job summary will be performing medical necessity reviews for prospective, concurrent, and retrospective cases, covering hospitalizations, home care, and other requests. The role ensures quality and cost-effective care aligned with client and company guidelines. So a medical necessity review, that can be either with using interqual or MCG, and their job posting does not mention whether they're using either or job, the interqual or MCG. And so for example, let's say a bedside nurse has a patient that comes in with a bowel obstruction, and let's say the CT of the stomach states the patient has a bowel obstruction that's positive for a bowel obstruction. So the doctor orders the nurse to put an NG tube to suction, as well as start IV fluids. Let's say the IV fluids is normal saline at 100 mils an hour, and also had the patient placed on NPO status. Now let's say, for example, interqual, I had that memorized regarding the interqual criteria. In order for that patient, aka member, regarding for the insurance nurse, in order for the insurance nurse to approve that patient's authorization and that patient inpatient stay, the patient must have a CT scan that's positive for a bowel obstruction. The patient must be NPO. The patient must have an NG tube to suction and must have IV fluids. So if all that criteria is met using interqual, the insurance nurse can approve the authorization. And the hospital nurse, who actually is a person who carries out most of those doctor's orders. So for the CT scan, the nurse doesn't do the CT scan. That's someone else in radiology. But the other criteria is done by the nurse at the bedside. So that's just an FYI of what medical necessity reviews are. That's for inpatient, and it's also retrospective. Let's say that that's basically a retro review, which we call it for short. Let's say the patient was admitted maybe a week or so ago, but we didn't get notification because the hospital didn't know what insurance the patient had, because maybe the patient came in unconscious from a car accident. And also covering hospitalizations, that's inpatient. There's also reviews for home care, and these other requests could also include skilled nursing facility, inpatient rehabilitation, and long-term acute care. So let's say the patient isn't well enough to go home after discharge. The patient may go to a skilled nursing facility, a long-term acute care, or inpatient rehabilitation after their discharge from the hospital. Also, just make sure that whenever you are creating your resume for these jobs, You want to make sure you focus on what you did, why it's important, and how it relates to the job that you currently want. So like I gave you the example about the bedside nurse versus the hospital nurse, and the authorization being approved due to what the bedside nurse did at the bedside. What you do at the bedside is very important regarding what the insurance nurses review and look at to get the authorization approved for these patients.